Welcome to The Explainer. For millions of couples, the diagnosis of unexplained infertility is just heartbreaking. But what if there was a hidden clue we've been missing for years? Well, a massive global study may have just found it. Let's break it down.
For so many couples, the road to starting a family is just filled with tests and questions and so much waiting. And sometimes, after all of that, every single result comes back perfectly normal. And you're left with this really painful mystery. And it's not a small number of people we're talking about here. About 15% of couples get this diagnosis of unexplained infertility. It is so frustrating because it means that even after all the standard tests, doctors just don't know why they can't conceive.
So that's the big question, right? What if there's a clue that these standard tests are missing? Okay, let's dive into this. We're going to talk about something called sperm DNA fragmentation, or SDF for short.
So what exactly is it? Well, SDF is basically damage, actual breaks in the DNA that's packed super tightly inside the sperm. If you think of that DNA as the architectural blueprint for a healthy baby, SDF means that blueprint is torn or damaged. And that, as you can imagine, can cause some serious problems for fertility. So where does this damage even come from? Well, it can boil down to a few things. Sometimes the body's quality control system messes up and it releases faulty sperm that should have been discarded. Other times, the DNA just isn't packaged properly, leaving it vulnerable. And then there's the big one, oxidative stress. That's damage from things all around us: infections, smoking, obesity, even environmental toxins.
Okay, so this sounds pretty important, right? If this could be a key clue to solving that unexplained diagnosis, why isn't SDF testing just standard practice? Why isn't it part of every workup?
Well, the answer, like so many things in medicine, is complicated. Because until very, very recently, the world's leading medical groups just could not agree on who should get this test or when.
And this slide just lays out the problem perfectly. On one side, you had the American guidelines basically saying, we don't really have a recommendation. But on the other side of the Atlantic, the European guidelines were strongly recommending the test for these exact cases. So you can imagine the confusion this caused for doctors and patients.
So to finally cut through all this confusion and get everyone on the same page, the Global Andrology Forum decided to do something pretty incredible. They launched a massive international investigation.
And we're not talking about a handful of experts in a room. They brought together 436 of the world's absolute top minds in reproductive medicine: urologists, embryologists, gynecologists, the whole shebang. And look at this, they came from 55 different countries. This wasn't just a US or European thing, this was a truly global effort, with experts from all over the world coming together to find some common ground. The way they did it was super rigorous, using a process called the Delphi method. It's basically a fancy way of saying they had this structured, multi-round debate. They surveyed what doctors were already doing, they argued over the evidence, and then they voted until they finally reached an agreement.
And the entire point of all this? To finally create one clear, global set of rules. No more conflicting advice, no more confusion. Just the first ever, evidence-based, globally endorsed guidelines on when to actually use this test.
So after all of that, what was the verdict? What did this massive global jury of experts finally decide?
But first, check this out. This is what's so fascinating. Before they even made the new guidelines, they found that more than 75% of these top specialists were already using the test for unexplained infertility. It turns out the doctors on the ground were way ahead of some of the official rulebooks.
So, after reviewing all the evidence, the surveys, and going through that intense debate process, they did it. They reached a clear, powerful, and global consensus. And here it is. They officially recommended SDF testing in several key situations. The big ones: number 1, for couples with that frustrating, unexplained infertility diagnosis. Also for couples who've experienced recurrent pregnancy loss. And they also recommended it after failed IVF cycles and for men with certain risk factors, like smoking or obesity.
I mean, this is a real game changer. This landmark study basically takes SDF testing from the controversial maybe pile and puts it firmly in the recommended pile for specific patients, giving doctors a clear roadmap to follow.
And you have to think about what this means for patients. It's massive. It means an end to some of that agonizing uncertainty. It's about giving people a potential diagnosis, a real reason where before there was just a giant question mark. So, the big question this leaves us with is a really hopeful one.
With this new global agreement, doctors and patients have a clearer path forward. This could potentially change everything for countless people trying to build a family, finally turning that painful mystery into a plan.